Dan's a graduate of the Arizona School of Acupuncture. He's also was a competitive cyclist for 15 years prior to this career. So I'm going to let Dan have the floor and
long time.
Tell us everything you've ever wanted to know about acupuncture.
Thanks, Brian. Thanks. It's nice to be here. Thanks, everyone, for coming down. Thanks. Appreciate it. As Brian said, for those of you who don't know me, my name is Dan Taylor, and I practice traditional Chinese medicine, which means that I'm a licensed acupuncturist, and I use herbology and Tuina, which is Chinese physical therapy, to treat patients in a clinic. And I'm really lucky because I get to work with a lot of athletes, professional athletes, amateur athletes. And the reason I say I'm lucky is because, well, a couple of reasons. Athletes are always after a goal. So it's nice to work with somebody who has a goal that they've set, because then you can kind of monitor what you've done, and either it's working or it's not. So there's some gratification working with people who set goals. It's nice. And they usually follow rules, too, because of the self-discipline. The other reason is, and I kind of hate to admit it, but come on in. Athletes are relatively easy to work on. And those of you who've been in my clinic, you're going to hear some things that I say, and I've told you before, but it's going to get repeated tonight and hopefully reinforced. But athletes are generally pretty easy to work on, and I like to use the analogy of a race car versus a jalopy, the family vehicle. Athletes are more like a race car. When you have an oil leak in a race car and you pop the hood, it's pretty obvious what's leaking. You can look right at the hose that's leaking and get it fixed. Whereas in the jalopy, you pop the hood and the oil's covered in dust, and there's parts missing, and there might be a pack rat's nest over here, and so there are a lot of layers with most mere mortals, the sedentary folks. So that's nice. That's nice. Tonight we're going to meet 3 of my athlete patients. So I'm going to pick at random 3 of you from the audience to come up and tell your story. And I'm totally kidding, actually. Just take a deep breath. Just kidding. Actually, I am going to talk to you about 3 patients, but they're figments of my imagination. I'm making them up. But I think what you'll see is that you'll see a little part of yourself in one of the athletes that I talk about, maybe all 3. And the information that follows, maybe it'll be useful to you. I'm going to try to stick to stuff that's really practical and get right to the point. Then, after I talk about these 3 patients, we're going to move into a little bit of Chinese medical theory and philosophy, which is the neat stuff. That's sort of the meat of the argument, and I'm going to leave that until the end. And then if we have some time left over and no one's stood up and walked away, then by that point in time we'll have some questions and answers. And that's your chance to stump me, because I know a lot of you here, and you probably want to grill Dan Taylor while he's standing in front of a lot of people. So that'll be fun. Throw me the hard questions. So let's meet Mike. Let's start out with Mike. Mike is a 41-year-old triathlete, and he's been competing for the better part of 10 years. I've been working with Mike for a couple of years. He complains of chronic low back pain, which we hear of a lot. And he comes into my clinic, and I help his back pain, and he's able to continue on training and racing. Well, Mike is a water type, and you're going to hear me talking about this a little bit tonight. The Wuxing, the 5 elements, metal, water, wood, fire, and earth. And it's actually a topic of a future talk, so we'll get to that sometime in detail in the future. But suffice it to say that Mike is the strong, silent type. He doesn't say much. He's pretty stocky, muscular guy, kind of short. And when he says something, it's either philosophical, deep, interesting, important. So when he calls me and tells me that he's got excruciating back pain, I know that there's a major problem. And it's an interesting story. He calls me and says, my back went out, and I said, where'd it go? And he said, out to breakfast, and hopefully it'll come back. We had that little conversation out of the acupuncture joke book. And he tells me an interesting story. He's at a triathlon, and he reaches up to the top of his car. He's going to get his bike down to go set up his transition. And he reaches up to get his bike, and as soon as he starts to pull it off the rack and set it down to the ground, his back goes out. And he describes to me a stabbing, fixed pain in the right side of his back. Absolutely excruciating. He drops the bike. He hits the deck, goes down. His wife has to walk around and help him out and help him go sit back in the car. Needless to say, he misses the race, and he's in my office on Monday morning. So I watch Mike walk into the office. I observe. That's one of our diagnostic tools in Chinese medicine. We try to observe a lot before we even say anything. And of course, it doesn't take a rocket scientist to realize he's in a lot of pain. So he's hobbling into my office with the assistance of his wife. And an interesting thing happens here. In Chinese medicine, our primary goal is to help the patient feel better first and then try to figure out what's wrong. We're not going to ask a bunch of diagnostic questions. I'm going to close this door so we don't have a vacuum noise. Beg your pardon. I'm not going to ask a bunch of diagnostic questions and grill the guy while he's standing there in pain. So I do, however, employ the very high-tech Chinese diagnostic tool of bend over and touch your toes. And, you know, he gets about this far, and he says, oh, that's it. It's a sharp, stabbing, fixed pain. And I say, okay, how about the squat test? Can you bend and squat? And he said, yeah, right, dude, I'm not even going to try. So right then and there, I know we need to help Mike. And so Mike gets face down on the table. I put some hot packs on his back, these clay packs that we heat up. And I heat him up. And as he's warming up, I roll his bladder channel out using tween eye, do some massage technique down his hamstrings. That's where the bladder channel runs. Now the bladder channel governs the back. That's all we really need to know. I'm not going to get a lot into complex Chinese medical theory. But the bladder channel runs down the back of the legs, and it governs the back. It actually runs down the entire back from the inner canthus of the eye, over the top of the head, down the back. It's a very long channel. So I'm massaging his hamstrings, and I noticed something. His hamstrings are as locked up as his back. This is an important piece. And I'm starting to kind of formulate some questions I want to ask him. And so at that point in time, I've got his hamstrings rolled out, nice and soft. We do a little bit of acupuncture, put some needles in the back of his knees, a couple in his calves, maybe a couple in his ankles, not many. So while he's sitting there with the hot packs and the needles, this is my chance to gather information. And I say, Mike, I've got a seemingly unrelated question here. Have you been exposed to any cold wind lately? Which is a ridiculous question to ask a triathlete, right? I mean, you're always exposed to the wind. And he said, well, yeah, in Mike's words, which is 2 words. Yes, he has been exposed to cold wind. And I pried a little bit more out of him. And what I learned was he was getting ready to, he was practicing transitions just a couple days before the event. So he was in the pool, and he would do some laps in the pool, and then he would pop out and go get on his bike and ride a little while. And it was, he told me, extremely cold. It was unseasonably cold and windy a couple days before his event. So here we are with the first take-home piece for endurance athletes. And this is something that's interesting, where your antenna should start to perk up. The Chinese actually consider the wind the largest external pathogenic factor known. And that doesn't make you feel so good. You know, every time you walk outside, you're going to be a little bit scared. But it's pretty interesting. The wind actually has a signature that can penetrate through just about anything. There's been studies done that show that the wind actually can penetrate through walls. So it certainly can penetrate into your body. But even on a hot day in China, you'll see the old folks covering themselves up if it's windy. They'll pop their collars, they'll cover their neck, and they'll always keep their skin covered in the wind. As a matter of fact, if you look at the Chinese track team during the Olympics, they're not hanging out there in their running shorts on the track. They always have running pants on. They always have some sort of warm-up pants on their legs, because they know that if the wind hits the bladder channel, it's going to affect the kidneys, it's going to affect the low back, and it also affects your energy level. So this is the first take-home piece. If it's the slightest bit cold, and I don't care if it's June, if you're up in the mountains doing a triathlon or any kind of event, it's slightly cold, keep your body covered, keep it out of the wind, and you'll be doing yourself some good. Maybe you won't get cramped up like Mike. Mike's got some other issues, though. It's a little bit deeper than that. At this point in time, you know, he's been relaxed on the table for a little while. Remove the needles, take the hot packs off, and I go to do a little more assessment on his back to find maybe exactly where the source of the pain is. And I start to press on his back, and as soon as I hit the spot where I think, you know, I assume he's showing me where the pain is, he jumps, and then he does something interesting that keys me off into another diagnosis. He makes this noise. He goes, "Oh, yeah, that feels good." Right? That tells me something. Actually, that is a diagnostic tool that we use in Chinese medicine. There's 2 types of pain. There's a deficiency pain, and there's an excess pain. Excess means too much is built up. And excess pain, when you touch it, feels very sharp, and they don't want you to touch it again. Ow, don't touch that. You know, at that point in time, he'd want to get off the table and throw down, because that fixed, sharp pain is an excess type pain. This pain, although it presents itself as excess, as I press, he makes this noise, "Oh yeah," which tells me it's deficiency. He needs energy in his back. Very simple. So what kind of deficiency are we looking at? Well, in this case, he's yang deficient. Yang deficient. We're going to talk about yin and yang in a little bit, and you can understand that.